I'd like to welcome everybody here to Pediatric Bone and Joint Day, October 19th. This is our 7th Pediatric Bone and Joint Day lecture series. Well, 7th year, but 6th series because we didn't have one last year. I'd first like to thank our sponsor for our food today. This is a company that makes waterproof casting, and thank you for sponsoring us. Okay. All right, so we'll start our lectures now. The lecture series is called Tackling Sports After COVID. Now, what happens to children when they stay home all day, every day? And that's what we're going to start out discussing. My name is Barbara Minkowitz. I am the Chief of Pediatric Orthopedics at Morristown and also the Medical Director of Pediatric Bone Health. So the goals for our discussion will include COVID-19's effect on sports and activity, the role of deconditioning and core strength on return to play, the role of posture and mobility, and the role of bone health. So you had COVID. What next? Well, there's no return to sports until you can perform your activities of daily living. You have to be able to wash yourself, feed yourself, all those kind of things, without any concerning signs and symptoms. Clearance is needed from your primary care physician after your isolation period. Further clearance is not required unless there are pulmonary or cardiac signs or if these symptoms develop with return to activity. Children less than 12 years old progress activity as tolerated. If you have severe COVID-19, multisystem inflammatory syndrome, otherwise known as MIS-C in children, you're restricted from exercise for a minimum of 3 to 6 months, and you need a cardiology clearance prior to return. With return, individuals and parents need to monitor the child for chest pain, shortness of breath, exertional intolerance, new onset palpitation, syncope, and if these occur, then the patient needs to be evaluated by their primary care physician and maybe a cardiologist. Our next speaker, Dr. Ellen Dean Davis, is going to go into this in more detail. There was a recent study where return to play using cardiac screening in professional athletes was performed, and this came out in JAMA this past year. So 789 athletes were found to have COVID, and these were Major League Soccer, baseball, hockey, and football players. All athletes were screened. Now, only 460 of these were symptomatic. At least one abnormal cardiac test was found in 30 patients, and 3 different tests were used. 25 of these were found to be false positives. They had no cardiac pathology, but they had a positive test. 3 had myocarditis, 2 pericarditis in patients that had moderate to severe symptoms. So this is 0.6%. There was no mortality. Now, it'll be interesting to see what happens in the future with these patients, since this was a very short-term follow-up study. But so far, these people are doing well. The same kind of study is being done in the NCAA, and this is being performed by a group called the Orca Study group. 19,378 athletes were tested, average age 20. Only 3,000 tested positive for COVID, and they had about a 0.8% cardiac involvement. They had no mortality and only 1 cardiac event, which was not due to COVID. So people do have cardiac events that have nothing to do with COVID. The conclusion is that COVID in this group is associated with a low prevalence of cardiac involvement and low risk of clinical event in the short term. Gradual progression back to sports is important. The American Academy of Pediatrics came out with a guideline, and as I stated, our next speaker will go into this in more depth. We need to look at return to sports as a marathon, not a sprint. And the American College of Sports Medicine has a 10% rule. They feel that you should resume activity at 10% the intensity and the duration of peak performance. So a runner who ran 10 miles before COVID or before they were inactive should only run 1 mile to start with to return to activity. Trainers and coaches should closely watch those who previously had COVID, and mask and temperature checks should be used as necessary. So take it slow, whether a child has or has not had COVID. Deconditioned children cannot jump back into high-intensity activity, although they think they can. You want to encourage taking care of themselves. Get out of bed, sit on a chair for school or homework. And I was horrified to find out that a lot of these children in the past year that were home spent all day, every day in bed. If they weren't in bed, they were on a sofa. But they basically were not moving very much and they were curled up. They need to get up, sit on a chair, put some active energy into it, stretch out their legs, their backs, their arms, work on their core, get back into shape. They need to eat well and take vitamins to build a strong body, and then they can return to sports. To go over some background about sports in the U.S. pre-COVID, 30 million children participated in sports. 3.5 million sustained sports-related injuries. Young athletes are not adequately prepared or trained for activity. Preseason conditioning significantly reduced injuries in adolescent athletes. One study showed that there was a 14% of those participating in preseason training sustained injuries versus 33% of those that did not participate. A study on knee injuries in high school football players showed a 61% injury reduction in linemen with preseason conditioning. We're going to go over some children now that I've seen recently that really kind of give you the picture of some of the injuries we're seeing now. And I feel like we're seeing a lot more injuries, especially right now, and specifically related to all this deconditioning and these kids really spending time in bed and curled up all day. So this is a 15-year-old who has right shoulder pain after pitching in softball. Now, if you look at my picture in the corner, top right corner, you see what the position of somebody is supposed to look like when they're pitching in softball. And our patient came in with pain in her pitching arm and basically had a pectoralis muscle sprain. So she had pain right where her pectoralis goes into her arm from bringing her arm back into a throwing position. In her, you could clearly see that her pectoralis was tight from poor posture, and she was pulling on this tight muscle when she was throwing. So she could not get into proper athletic form, which needs to be addressed by her coach. And every time I said to one of these children that got injured, I said, "So, has your coach told you that your form is poor?" They all admitted that yes, they know they have a problem with their form, but they have trouble figuring out how to deal with it. So in this patient, if you look at the first picture, you can see how she's sitting. She looks like she's sitting demurely, like, okay, I'm just waiting for you to examine me. But really, this is the way she sits all the time. And if you look at her shirt, you see how it's creased by her armpit? That's because her shoulders are sloped forward, and that's just where they go. If you look at picture number 2, you can really see how it's sloped forward. And if you look at picture number 3, you see how her neck is forward. This is her normal stance. When she stands up and she tries, I ask her to stand against the wall to really evaluate her alignment. Again, you see her head's forward, her shoulders are forward. If you look at picture number 2, and I ask her to get her head back, she can get her head back if she looks up at the ceiling. She cannot just bring her head back over her body. And if I ask her to get her shoulders against the wall, she's got to basically arch her back to get her shoulders to touch the wall. And at this point, she's feeling like her head's too high. She's doing all these things to try to be aligned. So when I have the parents come into the office and go, yes, I know my kid has a problem with posture, I keep telling them to stand straight. These children can't stand straight. They're too tight and they don't have the muscles to hold their shoulder blades in place. So she needs to be stretched out. She needs to be strengthened before she can get to that point. Here's a 17-year-old boy who is playing baseball. And he's got pain in his throwing arm. Basically, he's got triceps tendonitis, which is right above the elbow on the back side. And in him, it's just a tendonitis. But I actually have some children that have pain in the area, but over the bone. And they either have a stress reaction, or I actually had one kid that actually pulled off a piece of bone from that area. Now, if you look at the picture in the top right corner, you'll see how you have to get your shoulder back so that you can get your arm in position. And you can imagine that if your shoulder won't go back all the way, you're putting extra stress on your elbow to get into position, and you get injuries. So the patient can't get his arm in position to throw since, again, his pecs are too tight, pulling extra hard on his triceps. His hips and lower extremities are also tight. Now look at that picture again. You see the position of that picture's lower extremities. This kid can't even get his lower extremities into position properly because he's tight. Again, his shirt is creased at his armpits because he's sloped forward. As soon as you get these kids to stand up, the creases go away. I keep pointing it out to them to give them a reference point so they can look down and say, you know what, I need to fix this. In the first picture, again, it looks like, okay, he's relaxed, but he's stuck like this. Shoulders slope forward, head forward, and you've got this crease at the armpits. So baseball players with limited hip flexion and internal rotation are at risk for elbow injury. Limited hip range of motion causes improper trunk rotation, putting more stress on the elbow. And again, I've got some pictures showing you where the arm's got to go, for this football player, for this baseball player. Another study found a relationship between low back pain and hamstring tightness. Increased tightness was associated with more severe pain. And in the office, we see a lot of this, but we also see the iliotibial band and the gluteus as a major culprit in low back pain as well as knee pain. And you can see where the gluteus and the IT bands are. And you can imagine that if they're tight, they're pulling on your lower back. And if they're tight, they're pulling on your, they can be pulling on your knee as well. So flexibility is the key. Lounging all day and growing. So it's bad enough when we're adults or kids that have, finished growing or lounging all day. They're going to get some tightness, but can you imagine growing while you're all, you're sitting in this lounging position, all flexed in different areas that need to be stretched out? So a couple of things are going on here. Number one, non-weight bearing. All right, these kids are not up and running around and doing what they should be doing to make strong bones. You need weight bearing to make strong bones. Just getting up in the morning and doing jumping jacks has been showed to increase bone quality. So you got kids that are not doing jumping jacks. I'm not sure that they could even stand on one foot because they've got no core. But these children are in a bad way. Now they've got their back arched, which encourages poor core. They've got tight shoulder girdle muscles and neck muscles. Their knees are flexed, which encourages the tendons in the legs to be tight. Hamstrings, Achilles, iliotibial band. And they're really supposed to unfold and stretch out. So when a baby's born, it's supposed to stretch out, and they're supposed to keep stretching out as they grow, not regress to this fetal position. And I actually encourage these kids to try to sleep stretched out. Some kids that have been trying to stretch their hamstrings out and can't get them stretched out, if you talk to them, you realize they sleep in fetal position at night. So whatever stretching they do during the day, it's gone. Core muscles. Core weakness is a known risk factor for injury of the extremity in the back. Strong core reduces injury, enhances performance, improves bone health. Training core muscles contributes to controlled and functional movements. This is a requirement for good form. Children participating in core exercises in gym had increased muscular endurance, movement capability, and flexibility. And that's where I think we should be focusing our gym, on core muscles and flexibility. Posture and form in sports. Insufficient core promotes poor posture. In injured football players, it was found that poor posture, kyphosis, where they're rounded, abducted scapulae, where the scapulae are causing the sloped shoulders, and lordosis were associated with back and lower extremity injury. So I call this the poor posture epidemic, PPE. Adolescents are more sedentary. There's a rise of virtual school and daily use of tech while they're growing, worsening posture. Many don't know, they have no idea what sitting and standing straight is all about. In 2015, it was found that low physical activity promotes postural deviations. More than 50% of children had incorrect postures. So what do you think it is now? It's got to be up at 80 or 90, I would say. Patient's shoulders are rounded. They cannot touch the wall. In order to get his head back and his whole shoulders back, he's got to hike up his shoulders and arch his back. So you see that? So this kid is really, really tight. And if you feel his pectoralis tendon as it comes over to his shoulder, you can feel a tight band there. It is so tight when he tries to bring his shoulders back. Back pain from poor posture. So you lack muscular strength and flexibility to correct misalignment, and this patient cannot obtain and maintain a position of good posture. So this patient leaning forward has stretched his back out. You see how he comes to a point there? It's not supposed to look like that. And that's where he has pain, right where he comes to a point. So posture 101. And it's sort of interesting. I started using the wall, and then I had a patient from Poland who told me that when she was a kid, they had this test in school. They had the kids stand up against the wall twice a year to check on their posture. And it's actually very, very helpful. Use the wall as a tool to evaluate. Scapulae abduction and rounded shoulders, you see that in the first picture. See how she's rounded here. And you see how I asked her to stand against the wall here. And, she's trying to stand straight, but she's still got her rounded shoulders. Her head is forward like a turtle. And we don't need her to be a turtle, so we got her head back now. Feels like it's too high, and she's got her shoulders back. But you can use the doorway to help stretch those tight pecs. And the doorway stretch is something you can do every morning, and that's very helpful. So what to do? Look in the mirror. Use the mirror to look from the side. Take side view pictures. You want to look at yourself from the side. Instead of passing by a window or a mirror and looking at how you look from the front, check the way you're looking from the side. Get your head up. Even if it feels like it's too high or like your head's in the clouds, get it up, stretch it out, and you'll see how you feel. And you should feel better doing that. This is an interesting patient who is 11 years old. She came in with heel pain after running track. She has Achilles tendonitis, very tight hamstrings and Achilles. So she's really not set up to do any running yet. She needs to be stretched out. And her posture is atrocious. And again, you see her head forward. She can barely bring her head back at all when she attempts to line up. And so basically, she's stuck in this position. She's not going to get out of it without help. And so you send her to therapy. And I also have been working with a couple of my students, and we have 2 posture videos. One that's all exercises that can be done for posture, and the other one actually really helps you learn how to think about posture. And I use those as a tool in my office. I have the patients take a picture of the QR code, and they have something to use at home, especially after they finish therapy and they don't remember what the therapist said. Same thing with lower extremity stretching exercises. I have a QR code for those as well. We have a nice video for that. So now let's talk about runners. Look at the whole patient. Fixing tight hamstrings, Achilles, etc. with therapy is important, and it's easy. And they can walk in my office, and I can do that, and then I'm done. But don't miss what is happening in the upper body. It's better and more holistic treatment if you look at the whole patient. The patient's injury is linked to tightness, which was increased due to sedentary pandemic lifestyle. Without flexibility of upper and lower body, proper form for sports is not attainable, predisposing to injury. And running form, poor posture in running promotes overuse injuries. It's a known thing. You get plantar fasciitis, Achilles, hamstring injury, IT band, knee and low back pain. So good running posture increases energy efficiency. It's important. And you can see in the picture below how you have to be able to get up in order to have good running posture. Standing and sitting are active, not passive like lying in bed. I keep telling the kids in my office, you slump down into your bed, you're not supposed to slump into the chair, okay? I can understand you get tired by the end of the day, but it's an active process. You see, this is a nice picture over here of these girls sitting up. They're not looking for the back of the chair. They're putting energy into sitting up straight. See, this baby is not leaning forward. If he leaned forward, he's not going to be standing up for long. And these children are standing nicely. And here, you dump your load if you were not up nice and straight with your head back. So I think we should institute having the kids walk around with books on their head in gym. But basically, you need to be aware of your surroundings, have a balanced stance with your head back, good posture, and if you need to have your head in the clouds because you're so used to being down, then that's where it needs to be. Bone health. Of course, we have to talk about bone health since this is one of those areas that I'm particularly interested in. You have an increase in fractures due to the pandemic. So again, bone may be weaker due to decreased weight-bearing activity. These kids have been in bed for a year. You get what's called disuse atrophy. The bone starts to disappear because you're not weight-bearing. And you're not making good bone because you're not weight-bearing. How long does it take to fix the bone now that they've lost all this bone mass? And, I don't know that there are any studies going on right now. It would be interesting, but, it can literally take you years to recoup from something like that. Patients are not taking important supplements. They're not eating healthy. You have this pandemic weight gain. I have all these 100-pound 5-year-olds in my office. So it's a little bit frightening. You get deconditioning from the sedentary lifestyle. Our next speaker is going to go through how to get past that. This leads to poor form and poor bony alignment. And then the role of vitamin D. This is important for bone health. In New Jersey, there is not adequate vitamin D from the sun. With the pandemic, people are indoors more. They're not playing with their friends outside. Vitamin D is protective against fractures, and it promotes peak bone mass, and it's protective against COVID and other viruses. So it's important for your immune system. You need it. When patients are tight, they pull harder on bone. If the bone is poor, it's easier to break it. It makes sense. The role of vitamin D. Many of my patients have a vitamin D deficiency. I like to discuss what they're doing and what I think they should do. And it's important, when you have a supplementation approach, to take into account the fact that vitamin D is distributed in the body. Yes, we know it's fat soluble, gets distributed. So why do we give the same amount to everyone? Why does a 50-pound kid get the same as a 250-pound kid? I think that's wrong, and it doesn't work. So I discuss how much vitamin D to take based on size. It's also important to take into account that the half-life of vitamin D3 is 2 to 3 weeks. So you need to constantly take it. Otherwise, whatever you've taken will disappear. Vitamin D toxicity is really not a major issue at all. It's hard to become toxic unless you take ridiculous amounts or you have a problem with your liver or your kidney. And you wouldn't be toxic unless your levels became as high as 350 nanograms per ml. And basically, the lab thinks 30 is normal. Most of us think 40 to 60 is normal. And so 350 is really very high. Vitamin D deficiency is also associated with depression, aches, and pains. So if somebody comes to my office, I need to discuss aches and pains with them. We're going to have a nice talk soon regarding pediatric mental health. I'll just say that Physical activity plays an important role in mental health. Involvement in sports is associated with a larger hippocampal volume, whereas in depression, this area has reduced volume. There was an NPR article who quoted a pediatric emergency psychiatrist who lost a patient to suicide in 2020, and he said the pandemic had taken away his access to sports, which was his world. Child psychiatrists are seeing increased suicidal attempts and deaths, and we'll have a whole discussion about that. It is critical children get back outside on the field safely to support their overall well-being. I personally try to modify their activity once they're injured, but keep them active. So if somebody has finger injuries, I'll let them go to gym, but no ball sports. It's going to be very specific to their injury. In conclusion, children are embarking on an athletic journey exacerbated by the pandemic. Children must be physically prepared to return to activities. They need to be active for their physical and mental health. Thank you. And there are some references if anybody's interested.